Ketamine treats multiple conditions and can be used in 3 different ways. The first way is very low dose and can be used to treat pain, acute pain on very low doses. What we focus on are mood disorders and chronic pain. When you've been on multiple antidepressants, including SSRIs and SNRIs that interact with serotonin, it's a different key for the lock. Ketamine works on GABA and glutamate, which are 2 different neurotransmitters, and this one works differently. It regrows connections in the brain called dendritic spines, and it's a different neurotransmitter signaling pathway. So it's a completely different approach to the problem. So it's important to meet with your physician for an initial consultation to talk about all your medications that you're taking. But we encourage most of our patients, with the rare exceptions of benzodiazepines, possibly weaning off of those, holding Lamictal for 1 dosage because that can block how the ketamine works, and easing up on drinking more than 2 drinks a day. Most of the other medications that somebody takes, all the legal medications somebody takes, are fine to take in conjunction with ketamine, and they don't seem to have any drug-drug interaction that we would be concerned about. But it's important to meet with your physician because every situation can be a little bit different, and it's important to have a professional who's experienced. We haven't found any addictive properties of ketamine, no physiologic withdrawal issues, and no other issues like you would get with nicotine, like a nicotine fit, or alcohol, or benzodiazepine, or opiates. We haven't found any of those at the dosages that we're using. It has been reported in very high dosages that it could be addictive, but we haven't seen any in our practice, and that's of more than 1,000 patients. On label means that what the government has approved that medication or substance to treat. With ketamine, in 1970, it was approved on label for use as anesthesia, which is what its primary usage is presently. With ketamine being used off label, it's used for a different indication like depression, anxiety, suicidal ideation, but the government hasn't given it the thumbs up for that. Ketamine is a little bit different to the extent that S-ketamine, which is one of the enantiomers or molecules of the ketamine molecule, was taken, and Johnson & Johnson was kind enough to get FDA approval for S-ketamine, which is essentially the same exact molecule, for the treatment of depression and the treatment of suicidal ideation and gestures with depression.